Hello, my name is Julia Ellerston, and I would like to speak to you today about the Medicare Hearing Aid Coverage Act of 2021, also known as House of Representatives Bill 1118. First, let me start by telling you a little bit about myself. I am a speech-language pathologist at University of Utah's Voice Disorders Center. I specialize in voice, swallowing, and upper airway problems. I'm also a clinical doctorate student in the SLPD program at Massachusetts General Hospital Institute of Health Professions. I'm a member of the American Speech-Language Hearing Association, the Pan American Vocology Association, and Special Interest Groups 3 and 13. I'm the primary SLP on a Speak Out and Loud Crowd grant from Parkinson Voice Project, and I also am a volunteer medical legislative advocate for the Utah Speech, Language, and Hearing Association. So given all that, why would I care about hearing loss? Well, I've noticed anecdotally that hearing and voice interact. I have had several patients where their hearing loss has impacted how well they do in voice therapy. I've also had several patients where they have spouses who have hearing loss, and their voice disorder in combination with their spouse's hearing loss sort of gives them a double whammy type of situation. And so I looked a little bit further into this and found this study by Hengen et al. In 2018. And Hengen found that a larger proportion, almost 22% of the hearing aid users in their study exceeded the benchmark value for a voice disorder on the Voice Handicap Index. And the participants with hearing impairment who did not use hearing aids and the control group had fewer problems than predicted for their age in terms of how many of them qualified as having a voice disorder using the VHI as a benchmark, although the hearing impairment group that did not use hearing aids had a statistically significantly higher average score than the control group. I am also looking into potential changes to the voices of spousal partners and those with hearing loss. I have a pilot study forthcoming looking at vocal dose for both of these communication partners. Hearing loss affects 2/3 of adults by the time they reach age 70, and age-related hearing loss is the third chronic health condition, third most prevalent or third leading chronic health condition in the aged. Hearing loss is also associated with more than an estimated $981 billion total global economic cost across all age groups. So it's really quite a large cost when you look at kind of all potential people with hearing loss. So you might hear all of this and go, okay, I'm not an audiologist, I'm not a speech-language pathologist, you might be an OT or a PT. Why would you care about hearing loss? Why would this bill be important to you? Well, there are many other issues linked with hearing loss. There are psychosocial challenges, just something as simple as having to ask people to repeat things because you didn't hear them the first time, and having to repeat yourself to patients because they didn't hear you. Hearing loss has also been linked to mental health challenges such as depression. There are a number of studies, and I'll talk about this in a little more detail, linking a strong association between age-related hearing loss and mild cognitive impairment risk and risk for dementia, as well as an accelerated decline in overall cognitive function over time. And so this might be something that increases healthcare cost. There have also been links found between hearing loss and balance issues, and hearing loss and falls. And then all of these issues, because they affect kind of overall health, can feed into poor quality of life for those with hearing loss. There's also a growing body of literature looking at how hearing loss and its treatment may reduce Medicare spending. Deerdorf et al. In 2019 found in their multivariable logistic regression models that hearing impairment, visual impairment, or dual sensory impairment, meaning both hearing loss and vision impairment, were generally associated with increased odds of hospitalization and hospice use, regardless of that dementia status that we mentioned earlier. Reed et al. In 2019 found that untreated hearing loss was associated with $22,434 or 46% higher total healthcare costs over a 10-year period compared with costs for those without hearing loss. Persons with untreated hearing loss experienced more inpatient stays and were at greater risk for 30-day hospital readmissions. And this was true at that 10-year mark, with similar trends observed at the 2- and 5-year time points in that study. Simpson et al. In 2018 observed a 20% or more higher total healthcare payment over 18 months for a group of insured patients with hearing loss, regardless of insurance type or hearing services use. This may indicate that negative health-related effects of hearing loss may increase healthcare use unrelated to hearing loss. And Willink et al. In 2019 found sort of similar cost reduction with treatment of hearing loss. Thus, we want to see that clinical care to ameliorate hearing loss may improve overall patient health and reduce overall healthcare spending. And so this brings us to the Act itself. So Bill 1118 in the House of Representatives is sponsored by Representative Debbie Dingell. She is a Democrat from Michigan. And this currently has several co-sponsors with some bipartisan support. You can see Brian Fitzpatrick is a Republican from Pennsylvania. And so what this bill does is amend the title from U.S. Code Title 42, Chapter 7, Subchapter 18, Section 1395Y, to strike the language that currently is present to exclude Medicare coverage for hearing aids and examinations. And this would start on or after January 1st, 2022. This bill also calls for a study of programs, including health insurance that provide hearing aids. And so the study component of this, they would look at the number of individuals in the United States with hearing loss who need hearing aids, their coverage under insurance and other programs, and the effectiveness of such programs in meeting that need for hearing loss treatment. There's also a provision for studying programs that are designed to reduce or mitigate the incidence of hearing loss. And then all of this would be reported back to Congress after 18 months. So how can you support this bill? Well, you can contact your state representatives using an email template that I provide at this link and let them know that you would like them to support or co-sponsor House of Representatives Bill 1118. I think hearing loss is likely to affect many of us as we age, and it already affects a lot of our patients. And so I can see where if we can all band together, we can get this bill passed. If you're interested, these are some of the references that I used to make this presentation. And I hope that you will contact your representative to sponsor this bill. Thank you.